Tired of dealing with vein disease? Have your symptoms gotten worse?
Oh, these spider veins are ugly.
My legs and ankles are always swollen.
My legs are tired of standing all day.
While some symptoms can be managed by lifestyle changes, other factors are out of your control. Get help from the experts at Vein Clinics of Hawaii. To learn more about your treatment options, call 427-5565 or visit veinclinicsofhawaii.com. Aloha, Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Okay, well, hello there. Welcome back. Welcome to the program. If you just joined us, boy, it's nice to have you out there. We know that you have lots of things that you can do for this hour. We appreciate you spending time with us and, like the pedal in the pond, getting the word out. And this week, one of the things that I really like about the various programs we do, Doc, is that every now and again we are lucky enough to have, the fruits of your labor displayed here in a patient. And that's what we're going to do today. So we're going to find out about Sarah, and we're going to call her Sarah because that's her name. Hi, Sarah. So nice, very, very nice of you to join us. I always ask this question because, a lot of people don't know that Vein Clinics of Hawaii started on the Big Island, and they're on Kauai, on Maui, now here on Oahu. It's the number of people that go in there are not people that go in there. And, Doc, I'll get you for this because we'll get Sarah's opinion of it in a minute.
Sure.
And that is, not everybody goes in there with a life-threatening bleeding condition. It's not necessarily emergency stuff every day.
Right.
But isn't it sort of neat when people come to wherever they go, for one reason, they find out, hey, maybe I should bundle because there's other stuff going on here that's kind of neat. So that's kind of so. Let's go that route with you, Sarah. What brought you to the doors of Vein Clinics of Hawaii?
Well, I came in for some cosmetic, just some sclerotherapy.
But when you say you came in, how did you find out?
I just looked up online.
Yeah, see, we let Google do it. So that's kind of interesting, and so obviously it was just for something that you thought would be kind of neat. But I still want to know, because Doc, we talk about venous disease and venous areas. This wasn't disease at all, really. I mean, it was.
That part of it isn't, but the thing that a lot of people don't know is, a lot of the times all these things are sort of connected. You know, and that's one of the things we try to educate people on is that the symptoms are so there's such a wide spectrum of symptoms, and a lot of times people don't even know that the symptoms that they might be having are due to more of a medical problem rather than just a cosmetic issue.
And, that's interesting because today we're going to talk about the cosmetic thing first with Sarah. But then, I'm sure that maybe you were pleasantly surprised as I was when you go into the clinic. It's not all a bunch of women waiting to get spider veins done. It's guys. I'm a patient as well as a facilitator. So but did you know anybody else that had done this, or what was it that caused you to, I'll go Google this and find out what it was? What was the reason why you took a look at yourself and said, I don't think I like this, I want to change this?
Well, my mother had them.
Yeah.
Hereditary.
Thanks, Mom. Me too.
Yeah.
Thanks, Mom. Yeah.
So, and then I just talked to the doctor about, I was having some heaviness in my legs.
Okay.
And he just did a test, and then I had some disease there.
You're talking about the test, which is the lovely ultrasound. Was that fun?
Yes.
I liked it. Were you as fascinated as I was when you can actually see what's going on in your leg?
Yes.
But with that little thing.
Yes, it's quite amazing. You can see it right there.
Yeah. But still, so just so that a listener gets the understanding, what was it that you noticed that you wanted to look at? Was it your lower leg? Was it your calf, your thighs? Where on your body did you want to take a look at?
Well, I had some on my chest, actually, and one on my face that I wanted to be
that's kind of
taken
cool,
care
Doc.
of.
Yeah. Well, there's no vein that can hide.
Yeah. Well, a lot of people
we're an equal opportunity injector.
One thing that we learned, though, is that 99% of the people we're talking about venous areas are in the lower leg because that's where. But it's like we just did some really great programs this week and in previous weeks about you got veins on the top of your head from the top of your head to the bottom of your toes. Yeah. So it's where you notice it whether you want it changed, right. And so. But still, did Mom do it? Did Mom have treatment for her varicose veins?
Yeah, she did. She
not like the new kind of treatment.
No,
I would imagine.
No.
Well, and I believe that you had spider vein injections somewhere before.
I had. Yeah.
So Sarah had a.
She wasn't a newbie.
No, she wasn't a newbie.
No.
So she had a certain amount of insight into at least the cosmetic part of vein care. And how many times had you had the spider vein injections? Would you say
with you?
No, before.
Oh, before probably 3 or 4 times.
Yeah. So
over a period of years, right?
Yeah.
Mm-hmm. So she had a clue about what was going on, and she had a pretty good idea about what we would probably be doing for her spider veins. Now, were the prior injections that you had before? Were they just on your legs, or were they other places?
No, they were just on my chest and my arms.
Chest and arms. Okay.
Yep.
So, so that people come in for a variety of different reasons. I think that's what you're getting at. But the whole scope of vein care is so great. I mean, we take care of people who have real advanced forms of venous insufficiency.
Oh yeah,
have the ulcers and terrible things going on with their legs. And then at the other end of the spectrum, we have people who have just, they come in feeling like, well, this is just a cosmetic issue. And sometimes it is. Sometimes it is just a cosmetic issue, but we answer that question with ultrasound, as Sarah just mentioned.
Okay, here's a good one, Sarah. I think that this is fun for me in that, I do know that a lot of times when we talk to a lot of lady patients that we've had here and my mom and others very, very active outdoors that then stop doing it because they thought that the first thing people saw was that thing on their leg or that thing on their chest or whatever. Mm-hmm. Were there any activities or any things that you had stopped doing because you were concerned about the way it looked?
No.
That's cool. Okay.
I just kept up with everything. Yeah. I didn't really have many on my legs, actually. So just some heaviness.
Yeah.
And I was surprised that it was taken care of with insurance.
Yeah, and that's the other thing. When we talk about that, Doc, there are some things that are clearly cosmetic, elective things, right?
Right.
Like a spider vein on the chest or the arm or something. The insurance companies would say, "Oh, Sarah, you're going to die if you don't get this done." That's the opposite, right?
Right. And not only that, but it's also it's not part of a pathologic process. Mm-hmm. Varicose veins and the other symptoms that we see in people's legs. That's part of the pathology of venous insufficiency. That's happening because those veins in the legs are failing. Prominent veins on the face or on the arms or whatever. That's not happening because something's going wrong. Mm-hmm. That's just happening because of the your skin quality or genetics or whatever that make those vessels a little more prominent, and you may or may not like the appearance of that.
Yeah, but they see from Sarah what I'm gathering earlier is that the symptoms that you were having had nothing to do with those veins. You know what I mean? The symptoms were of a larger issue, Doc. Is that what,
sure.
So let's talk about, for instance, maybe I know people are out there thinking, well, what does the insurance cover? That's a good question, and I know you get that all the time, and whether or not that may be the game changer. Maybe if somebody says, well, does insurance cover this? And you say, no, well, I'm not going to do it.
Yeah.
But in actual fact, at what point in time, say in Sarah's case, do you remember making the difference between something that's a cosmetic elective and something that's going to be covered?
Well, part of that is the fact that we have a fairly complete questionnaire for everybody who comes in.
Oh, the iPad. You had the iPad, right?
Yes.
Me too. Good fun.
The lovely iPad. Yeah. And that's why we ask all those questions because of the fact that, again, a lot of people don't know which symptoms are related to vein problems and which ones are not. And so we have just a general questionnaire about all of the symptoms that you might be having that may or may not be even related to venous insufficiency. Well, Sarah was one of those people that came in, and even though she was coming in for primarily spider vein therapy, she answered in the affirmative for some of the symptoms that have to do with venous insufficiency of the legs.
Okay,
and
wait,
then we
wait,
just
wait.
kind of go from there.
With that being said, Sarah,
Yeah.
were you surprised that some of the symptoms were indicative of a venous issue?
No.
In other words, heavy leg is a heavy leg, right?
Yeah,
Or-
you
or-
just kind of don't think about it.
Yeah,
you just are like, oh, that's just the way I feel.
Yeah.
And I'm old, so.
Yeah, yeah.
You feel it more as you get older.
That's the other thing. That's the other thing. Isn't it true, Doc, that a lot of people are expecting that, well, I'm getting older. I should expect not to do this. I expect you to do that.
Right.
And in some cases, that's just not true.
No.
It can reverse the situation and make people's legs not be heavy anymore.
Yeah, we hear that all the time. I mean, people are constantly coming in and either using age as a reason why they have a symptom, and it's fun to talk to those people because they're obviously having symptoms of venous insufficiency, but they're just chalking it up to age, or I played volleyball a lot, or whatever. And
Football injury. My case, it's an old football injury.
Yeah.
Right.
And very often it's not the case. And, that's the other thing that we try to get out there to people that, if you have complaints, most of the time it's probably not, it shouldn't just be chalked up to, whatever. There's usually a medical cause or reason for that complaint. And, nothing could be truer for venous insufficiency.
So in this case, with Sarah, she exhibited symptoms that needed examination. And so the first things first, ultrasound?
Yeah. So, we have, again, our set of questions, and if they're answering a number of those questions in the affirmative that would, make us feel like, gee, maybe this patient does have venous insufficiency, then, we do ultrasound. That's sort of our screening, not only our screening, but our diagnostic, our main diagnostic tool. Because the ultrasound anymore can tell us so much about vascular function, especially as it pertains to veins. And we did an ultrasound and we found out what she had, basically.
Okay, Sarah. Now?
Yeah.
A lot of times when we are fortunate enough to have a patient here, this is somebody that's been under treatment for a long time, and there's 6 different stages of varicose veins, and they're at number 6. You're way down at the other number, Doc. Where would you say Sarah was when she first started getting treatment?
She was 2 to 3.
Yeah. So right. So that and what I think that everybody wants to know, were any of these symptoms either preventing you from doing things you wanted to do or discouraging you from doing things? Like heavy legs, maybe. Let's go for a walk. Your husband says after dinner, let's go for a walk. I don't think so. My legs are sore.
Yeah. I felt more worn out. And now I feel lighter and I don't have any symptoms anymore. And it's just so nice. And the office and the doctor, they're so wonderful about answering questions. And
see what I mean?
Yeah.
It's embarrassing. This is radio, so you can't see doctors' blood. But it's true. It's true. I see that and I hear that all the time. And I think it maybe is. And I'll ask the dreaded question. Have you been given the socks, the compression socks?
Oh, yes.
Okay. We are all wearing, I wear mine like all the time.
Now.
Yeah. Now, but did you find that, first of all, no problem? Did you wear them religiously, or did you?
No. I mean, I did after treatment. Yes.
A truthful patient. This is good.
They're just so hot.
Yeah, well, I mean, we hear that all the time, and I wish there was a way to get around it. But and some of the things we do do not require wearing the stockings, for a period of time after the treatment. But most of the things we do need that, and also, it kind of helps us in our decision making, because when people come in with complaints that may not be absolute, there are some symptoms that people come in with that we know, these are related to venous insufficiency. Sarah had heaviness, fatigue, that kind of thing, a little bit of swelling, I think, and all those things are definitely connected to venous insufficiency. Some things are not. The people have a lot of people have cramping as a symptom. Now, there's a certain amount of cramping there's a big amount of cramping that can be secondary to venous insufficiency, but there's a good amount of cramping that's not. Somebody doesn't have venous insufficiency, but they have cramps in the middle of the night, and so we often will have people wear stockings to test out a theory. If we're not sure.
You mean for swelling, for stuff like that?
Well, yeah, for symptoms.
Yeah.
So, if we're not absolutely sure whether a patient's symptoms are due to venous insufficiency, number one, we do the ultrasound to see if they have it. But if they don't have, for instance, as much as we thought they were going to have or whatever, then often we'll put them in stockings and see how they respond. If they respond well to stockings, if the stockings really do take care of their symptoms pretty well, then that makes it a little we're more comfortable in saying, you need treatment, and I think it's a pretty good likelihood that your symptoms will be addressed by treatment.
Yeah, and that's the other thing, Sarah. I think that just for my own sake that I should wear them all the time because I've had a lot of work done. In your case, you're a relative newcomer to this. What were your thoughts when you first? Okay, I'm going to do it. You found out that what procedure you were going to have done, and what was it like for you when you went in there the first time to have treatment? Not on the spider veins.
Okay.
On the vasculars.
Yeah. No, it was fine. Everybody kept me calm, and
which was not an easy job.
Yeah. And it was fairly quick and pain-free. I didn't feel anything.
Yeah, that's really good.
Yeah, Sarah had just, I think, as I recall, one vein. It was a great saphenous vein. That's probably the most important, superficial vein that we work on, and that was incompetent or refluxing in both of her legs. So she just had one procedure done on each leg. And as I recall, I think he had a couple bulgy veins here and there that we got rid of. We did some injections.
That's called bundling. Good in for one thing, get another thing. Matter of fact,
and we did endovenous ablation using a radiofrequency catheter. And that radiofrequency catheter creates heat inside the vein and basically closes the vein down. So, why do we close that vein? Why do we want to close that vein down? We want to close that vein down because when you have reflux, it's not doing you any favors. It's kind of working against you. And it's not like we don't currently have the technology to repair those tiny little valves that are inside those veins. So the next best thing is to close it down. And that eliminates that abnormal downward flow, something that we call reflux. So the blood gets rerouted to normal vein, comes back up to the heart the way that it should, and it essentially eliminates the problem.
Okay, so I want to get back to the stocking thing just in case you think you're not relegated to wearing them for the rest of your life. But obviously, did you feel that they did help you with the heaviness or with the tiredness before you even had the procedure?
Yes, they did. Yeah.
That's the encouraging part, isn't it?
Yeah. And Sarah was one of those people that we wondered whether doing those procedures on her were going to address all of her symptoms, and we were after she said the stockings did a very good job, we were much more comfortable in feeling like doing those procedures were going to be beneficial for her.
One thing I got to ask you, Sarah, because I'm the same way. I thought, well, listen, I'm having all this work done. You're taking the vein out, or you're killing the vein. Now what's going to happen? I mean, is this going to am I going to get a new one, or what? Did you feel that at all? What do you mean you're going to close down my vein?
Well, yeah, it sounds crazy, doesn't it? Yeah. You just kind of you're thinking, oh, am I gonna have another one pop up?
Yeah.
But I didn't have any problems with that.
Yeah. But I think it's interesting because I remember when my mom, back in way a long time ago, long before any of these procedures were even on the drawing boards,
sure,
it was major. She would be in the hospital, and it was just a terrible thing. So I thought to myself, can you just keep taking these veins out and stripping them and stripping them and stripping them? And then Doc does he? Well, don't worry, Mother Nature's a wonderful thing because there's going to be a new one, a new
A new route.
path.
A new route, yeah. We get that question every day of the week. Yeah. What's the downside? But am I going to be able to do okay without that vein? And I keep telling people, you're going to do better because right now it's working against you. But the thing to keep in mind is back in the day when your mother was treated, that vein was stripped out of the leg. So, we were, even back then...
It was awful.
But even back then, we were removing the function of that vein. Mm-hmm. The function of that vein, even though it was abnormal, it was being eliminated by virtue of the fact that you're taking the vein out. Yeah. So we achieved the same thing by closing that vein down. We're achieving the exact same thing that was achieved back in the day when we did surgical vein stripping. However, at a much more in a much more comfortable fashion.
Walk in, walk out.
Yeah, much easier.
I'm telling you.
Yeah, exactly. Yeah. Back then, people were in the hospital for 2 or 3 days, and it was uncomfortable.
Okay, so I want to go back to Sarah's first day or first procedure of the non-cosmetic stuff. About how long? About an hour?
Yeah, I think it was hour and a half, maybe. Was it? Yeah.
And then, what about the follow-up?
The follow-up.
Yeah, no, you went home that day.
Yes. Yes.
With a list of things to watch for.
Right.
Yeah.
Yep.
Did any of them happen?
No, I didn't have any problems. No. If I had, I would have called.
Yeah, and I think, Doc, maybe that's part of the deal because taking the first step is what we try to do with this show, right? Mm-hmm. I mean, and it looks like Sarah is the perfect person to give us an example as a newbie, as somebody that just had some symptom and some miraculous thing happened and she got there, and then all of a sudden you were able to diagnose and lay out a treatment plan. How did you feel about that part of what Doc and the ultrasound operator did and that stuff as far as making you comfortable about what was going on?
They explained everything, and that was really nice because I had a lot of questions.
Like?
Okay, how long is this? Is this going to hurt? Is this going to take a lot of time? What and healing? I want to know about healing, and because I'm very active and.
Yeah, a lot of people. That's probably the main question that we get concerning. What's going to happen afterward is how much downtime is there going to be, and we tell everybody, it's not. There's really no absolute downtime. I mean, Sarah, you left the office probably and kind of went on with your day, right?
Yeah.
So there are a few things that we ask people not to do, but those are very few. We don't want patients doing a lot of heavy lifting, for a few days after their procedures. We don't want them going into the ocean for a couple weeks, but that's primarily from a sanitary infection kind of standpoint.
I had to use a lovely bag on my leg to take a shower. Yeah, I didn't like that too much.
That's probably the worst part of it is difficulty with bathing and showering.
Okay, but I got this one. I had this one, Sarah, that you'd have these things that were visible, but when you got the treatment, was there some discoloration and some stuff that you thought, when's this going to go away?
Yes. Well, there was bruising.
Yeah.
And the bruising, just lingered a little while. But once, probably a month had passed, and I was all back to normal.
Exactly. That's
great.
what I was going to say.
I was better than ever.
And I remember I had one on the top of my thigh that I'd had for 30 years. And it looked, after the treatment, it looked worse than it did. And I thought, oh, no, this was a big mistake. And then, like the doc said, trust me, it's going to go away, and it went away.
Yep.
Now I can't even see that place. It was terrible before.
Yeah.
But see, I think, Doctor, isn't that kind of why that people like Sarah, once they've taken the leap of faith, that it's going to be taking care of the symptoms. That's what's happened.
Mm-hmm. And it is a little bit of a leap of faith. We try to instill confidence in our patients by explaining everything to them and making sure that they know exactly what's going to happen. Because most of the people that come in for medically related vein care, it's not like they've had it before, and often they haven't heard from friends and family members about similar kind of treatments, because by and large many of these treatments are pretty new. But So it's we have to make sure that people are comfortable, and it's not like if somebody's going to go have their gallbladder out. I mean, they've heard about that before, and they know a little bit about what that entails, et cetera. But a lot of the vein care they don't, and we try to help them through it.
Have you been able to share that with friends and stuff? There's a lot of women that they know they should do something, but they don't because they're afraid.
Mm-hmm.
Yes. You went right by that somewhere.
Yeah.
So I guess mainly, and I think Hawaii has a lot to do with it because we're outdoors more here,
right?
And we're not covered by as many layers of clothing, in our normal time. So that must. I'm wondering about self-esteem and about things like, okay, world, here I am today. I'm looking pretty good. Check this out, and so that
exactly.
And I want to know how that has helped you maybe recognize not necessarily that you want to have more surgery, but that you want to stay on top of things and you want to keep it from getting like that was.
Right. Well, I definitely notice a huge difference, and I do feel younger. I feel like I'm back in my 20s again.
Yeah. Well, you could have fooled me.
Wow.
Hey. Yeah, that's pretty good.
Didn't know you were that.
Yeah.
Of course, that was
I thought she was in her 20s.
a few years ago.
Yeah. I'm thinking she is in her 20s. Back to the future.
You guys are adorable.
But I
Keep it
still
going.
think, I do know that it does play in everything we do, whether it's, some people don't want to go out because they think, people see that big thing on my leg. I don't want to see it.
Right.
Yeah, there's a huge number of people who don't do things like that because of especially veins on their legs. I can't tell you how many women come in and say, "Oh yeah, I haven't had shorts on in 10 years," and I'm going, "Wow, you really must feel very bad about something to not want to wear shorts, especially in a place like Hawaii." So and that gives us a tremendous amount of satisfaction.
Sure.
Knowing that after we treat these people and then when they do come back, they say, "Oh yeah, wearing shorts and short dresses," and it gives you a tremendous sense of satisfaction.
You know what I'd like to ask you, Sarah, and that is that I've become very observant. When I'm around and I see other people,
sure.
and I'm thinking, I wonder if, Sarah, if you've seen somebody and you almost want to say, "Hey, you know what? You better go get that thing looked at."
Yes.
Do you find yourself being more observant?
Yes, I'm definitely more observant.
Was there at any time? Was there concern or embarrassment for you not to want to be seen? That's a bad way to ask it. Was there a time that you decided maybe I won't go there today because of this, or maybe I don't want to do that today because of this?
No, not really.
That's good.
Yeah.
She's a A-type personality.
Yeah.
That helps a lot too, doesn't it? But
she's got a tremendous amount of self-confidence.
But seriously, but let's talk about the thing that maybe led her to do it was the symptom. But let's talk about how when you have the surgery, when that symptom goes away, that there's really been progress made that you may not be able to measure.
Yeah. Well,
you're
right.
I'm sorry, that you can measure.
Can measure. Yeah. Well, kind of both because just with respect to activity. And sometimes strenuous activity. The other thing that we hear from a lot of people is, "Gee, my legs feel so bad I can't go to the gym anymore, or I can't. I used to bike ride or hike,
bike ride or whatever."
And again, I mean, the symptoms come on slowly and over such a long period of time that they think it's just a natural kind of process. And it's nice to see them then, kind of return to their, proper mindset after their legs are fixed and they're feeling better.
Yeah, and I want to make sure that if you're just joining us, you got to go to veinclinicsofhawaii.com. That's veinclinicsofhawaii.com and just see the sort of some of the scope of things that are available there. And by the way, a lot of it is just fun. And that's what I think the neat part about meeting Sarah was that you went in to have the fun part.
Yes.
You want to get in. I don't like this thing on my chest. It's out of there.
Yeah.
And now it is, you know. But I still think that maybe was anybody in your circle skeptical? What do you want to do that for? You don't need to do that.
No. I kept it to myself.
Yeah. But I think that's good. Doc, a lot of people do that, and I guess it's mostly the men, because I'm noticing if I'm walking behind a guy and he's got veins bulging out of the back of his leg, poor guy, got to get fixed. Mm-hmm. But I don't think about that. I don't think about that.
Yeah.
Whereas I think the ladies are more likely to do slightly more thorough examination and rejection of something that they don't like.
Yes.
But it's, Doc, this is a good example, and I think that probably the conversations that went on between the two of you in the very beginning are important for people to understand what happens when they have that thing. I think I'll go see this, Doc. I think I'll go get this done.
Yeah. There is that point. And often it takes people a fair amount of time to get to that point, because they a lot of people come in and they'll say, "Oh yeah, I've been seeing your ads or hearing you on the radio or whatever for a year, or 6 months," and so I finally decided to come in. Now, if it's a guy, often it's his wife telling him he has to go in.
Yeah. I'm not going to the beach with you anymore until you get that thing fixed.
Because although interestingly enough, we have a bunch of male patients. Probably 40% of our patients are male, but at least 40%. So it's a little more common in women, but it's very common in men too. It's just I think that men tend to come in a little later in the process as opposed to women. But we see a lot of men, and it's fun to fix them up too.
Sure, but what I'm thinking is, and then the other thing is, and Sarah, you mentioned early in the piece, and we need to make sure that people understand. One of the things that might happen is when you have a symptom like you did, then the doc is going to apply on your behalf for insurance. You already know.
Yeah.
99% of the people, the minute you diagnose them, if their insurance is going to cover it or not, right?
Yeah, typically. And pretty much all of the major insurance carriers cover, this stuff. But we have to be very careful about it, because we see the patient, we evaluate things fully, we decide what we think should be done, talk about those steps with the patient. And once we have a sort of a treatment plan in place, then we interact with the insurance company and get their, authorization to make sure that everything is going to be covered, to make sure there's no surprises. And so that's something that we do. The patient does not have to do that.
But what I'm guessing at, and I'm not, don't want to put words in your mouth, Sarah, but what you did was the surgery that you had done for these symptoms was one thing. The other part is the cosmetic part,
right?
Which you said that you had already decided you wanted to have that done. Would there be a game changer if somebody said the other stuff wasn't covered?
No, I still would have done it.
I think that's important because, Doc, we talk about that a lot. And to be really honest, I mean, you're not going to submit anything to an insurance company that's going to taint your own reputation.
Right.
They already know when something comes in from Vein Clinics of Hawaii, it is something that needs medical attention and needs to be covered.
We hope that's the case, yes. But I think the other part of that is that some people come in with just spider veins and they don't have any other problem, and we're going to treat their spider veins. They don't need the medical part of it. And Sarah falls into this category. People will come in with spider veins and they think that's all they have. But we, investigate their symptoms. If they have symptoms, then we might find that they have venous insufficiency. So, but in that case, then they're sort of going hand in hand. Spider veins without underlying venous insufficiency is just, sporadic, probably genetically acquired spider veins. But spider veins can also be a part of the greater, picture of venous insufficiency. If we fix the underlying venous insufficiency, it does make treating and managing spider veins easier because we don't have that reason for spider veins to be occurring. And that was Sarah's case also. With respect to someone like Sarah, would she want to do both? Or would she choose to do just one and not the other? It's always a little more medically optimal if you do treat both.
Yeah, and that being said, Sarah, obviously, you'd already made up your mind. The cosmetic part pre-decided, I'm going to go do this.
Right.
I don't care what it costs. I want to look pretty.
Right.
You know? However, in that you have this other symptom, at what point in time did you realize that might be Venus too? Was that when you went in there for the cosmetic?
Yes.
And yeah, so that means it must be a good idea for anybody, Doc, if they've got anything that might be symptomatic of Venus disease, to go get it checked.
Sure. Yeah, it's one of the the superficial stuff that we see are often the telltale signs of a vein problem. If you have superficial veins that are especially if they're becoming more and more prominent over time, and especially if you have varicose veins. I mean, virtually all the time, if somebody has varicose veins, there is some underlying reason concerning their venous function that they're developing varicose veins. Not the same for spider veins, but when people have those telltale signs. And especially if they, in addition, have the symptoms, heaviness, fatigue, achiness, cramping, restless leg syndrome, all those things, then, it would be the proper, route to get it looked at, sure.
Yeah, if you're just joining us, Sarah's, like most of us that suffer venous disease, thanks, Mom, because it's a pass-along, don't pass back. But it's still of interest to me that when the symptoms themselves, some people say my leg's throbbing. Some say it's burning. Some say it's itching. What other symptoms did you have? You said yours was heaviness?
Yes, and aching.
Aching.
Yeah.
Did you do the thing that we all do? Did you find yourself elevating your legs a lot?
Yes. Yes.
Help?
Oh, while I had them elevated.
I was going to say, that's the danger. I watch TV for 2 hours with my legs elevated. And I feel great. I'd stand up to go get a glass of water, right back again at you. But yet, if you find yourself doing that, doesn't that mean that you want to reach out and talk to somebody? I mean, you did that cosmetically. Did you ever talk to your primary care physician about my legs are heavy or I'm tired?
No, I don't think I did. Yeah. No, it's just when you go in for a checkup with the doctor, it's kind of the last thing you remember to say
I always, when I finished, when I finished with that, I think, geez, I wish I'd asked him about this. I forgot to ask him about that.
Elevating the legs, that's one of the questions that we ask. Do you, especially at the end of the day, do you go home? Do you elevate your legs? And does it make your legs feel better? Yeah. That's sort of a golden sign of venous insufficiency.
Well, a lot of people get home, and the first thing they do is grab a cold beer and stick their legs up in the air because they've had it. So I think that maybe, and so I'm going to guess that maybe some of the activities that you didn't do as long or didn't do as often are gone, that you can now go do stuff and not worry about getting tired.
Yes. Mm-hmm.
I like that. That's kind of another big bonus, isn't it?
Sure.
What may have happened had Sarah not picked up on the fact that she wanted to have this looked at? If you go along with heavy legs for a long time, what could be going on in there?
Well, I think the important thing there is that venous insufficiency is a mechanical problem. We've talked about that many times. It's a valve failure within the vein, and since it is a mechanical problem, it's not like we can do anything to reverse it. Once the damage is there in the valve, it's not going to, reconstitute. There aren't really lifestyle changes that we can make to either, reverse the process or even, treat the symptoms as they are right now. It's not like arterial disease where, if you stop smoking, if you watch your cholesterol, if you, lose weight, et cetera, you can really impact the process of arterial atherosclerotic disease. Not so with veins. So, the natural history of veins is just for it to slowly get worse with time. And
which is a horrible thing, isn't it? Oh, dang, I don't want that.
Yeah,
I want to stop.
Sure. Yeah, so they're only going to get more symptomatic. And you can and also you might with time have some of the very negative repercussions of venous insufficiency, like chronic swelling, skin changes, all that sort of stuff.
Okay, I think that where it's kind of neat, and we talked to Sarah a little bit about this before, that you had this heaviness. Had you ever gotten to a point where it was enough that you wanted to take medicine, take aspirin or do something? Was it? I can take one of these things to get rid of this pain.
Yes.
So you did that?
Yes, I would.
Yeah.
Mm-hmm.
Do you do it anymore?
No.
See,
not
this
at all.
Is good. Yeah. What did you take?
Tylenol.
Yeah. See, Doc. I mean, people, they know when something's wrong, don't they?
Mm-hmm. Yeah.
Yeah. But isn't it neat when you say you don't need to take those anymore?
Right. Yeah. Well, I think Sarah's a good patient because she identified symptoms and decided to do the appropriate thing, which was to investigate and treat. But a lot of people will ignore symptoms, and they'll take whatever medication kind of works as a Band-Aid. It doesn't change things, but it does make their symptoms a little more tolerable. But at some point they
the other thing, Sarah, of course, we talk with a lot of people about a lot of other patients that maybe the reason that drove them to see the doc was not just discomfort, but because they couldn't continue the activities. Some people work and they couldn't stand up. They stand up for a job. Pretty soon in the afternoon, their job gets in jeopardy. So it didn't seem to me that you were really penalized from doing too many things, but there must have been some things that that, hey, you know what, I can go back to doing this a little bit more now. Are there any examples of that for you?
Well, I can hike longer.
Yeah. And you like that?
Yeah.
Yeah.
I do.
If that was the only benefit, Doc, wouldn't that be enough?
Yeah, sure. Yeah. We all exercise is one of those things that we hear about. Gee, my legs feel so bad. I can't go to the gym anymore. Yeah. Well, when that starts, then that starts
quality of life issues, huh?
Well, quality of life, and then also just general health issues. Also, if you can't exercise, you can't maintain your good general health, and that's a bad thing not only for your legs but everything else.
Do you have any? Did you have any difficulty before, or are you having any? Not difficulty now doing something cardiovascular like riding a bike, or when hiking can be cardiovascular too, right?
Oh, absolutely.
If it's a brisk walk, it's better than a slow walk. So I want to know about just the other sense of well-being that you have with your body outside of the pain that you used to have in your legs.
Yeah.
So when was this, by the way?
When I had
the procedure the last
about
procedure?
A year ago? Yeah. I think so.
Roughly a year ago. Yeah.
And then I'm hoping, and this is why we try to tell everybody on every show, that once you go through treatment and get whatever the symptom goes away, that you need to be like your eye doctor or like your dentist. You got to go once a year and get checked out, right?
Yeah.
So this is about that time for Sarah?
Yeah, typically we like to do what we call surveillance ultrasounds on a yearly basis. And, that's coming up. We need to make that appointment right now.
Okay.
Yeah, I wasn't shilling for more business, but what I was saying that, one of the neat things that I saw, and that's why I asked Sarah, in the very beginning of the show, wasn't it fun to be able to see the screen when you're having the ultrasound, and they'll show you by putting the pressure and you see, or you hear that sound, that you can be, and that means that they've kept that. And so when you come in a year later, you can see if there's been any, if you're in a holding pattern or if there's been more.
Yeah. I think that is an important part of the way we do things now, as opposed to what we did, in the olden days when we operated on people and said, see you later. I think we've gotten a lot better on following people over time. And it's important to do that with venous disease because, since it is a genetic problem, it's not like we're changing your genetics. It's not like we're changing your propensity to have vein issues. We're just treating whatever is a problem right at that moment. So might people who have venous insufficiency or vein problems, might they have other problems in the future? Yeah. Is it? It's fairly unlikely that they would have to have the same things repeated because, the devices that we have these days and the way we do it, and et cetera, it's a pretty reliable kind of, intervention that we do. So that shouldn't be a problem. But can other things arise? Yeah. Are there other veins in your legs that, might become insufficient at some point in the future? Yeah. And, the only way we do that, the only way we can follow that is by symptoms and then also by doing periodic ultrasounds.
Okay. Earlier, we found out that Sarah can thank Mom like me for this. Siblings? Anybody else in the family that did or did not have varicose vein issues?
They did not.
Yeah.
My brother.
See, so it doesn't necessarily mean just because you have the propensity to have it, but doesn't mean you're going to have it, right?
Right. Yeah. The genetics may or may not be handed down, but was it just your mother or your mother and your father?
Just my mother.
Just your mother.
See, because when it's both, now
it's way up
every
there.
kid's going to get it.
If it's both, it's almost inevitable that you'll have it. But if it's one, it's around 50-50. It's around 60% that you'll have some form of venous insufficiency.
Over what period of time would you say that before you had treatment, before you met Doc and had the treatment done, for what period of time had you been sort of putting up with this?
Oh, probably 6 years.
That's not very long. Sometimes, Doc, I haven't been able to stand up for more than an hour for 20 years.
That and also just people with the worser forms of the disease with ulceration and skin problems. That sometimes we hear people, putting up with that for months and years also.
Hey, I'll bet you, Sarah, if you're like me, when you're at the office and you see some of the videos or something, boy, I'm never going to get like that. I'm going to keep an eye on this stuff.
Exactly.
I'm not going to do that. That's not on my program.
Exactly.
Yeah. I think, Doc, though, that maybe what we're talking about is differentiating. When we first started talking to Sarah, what drew her into the Vein Clinics of Hawaii family was cosmetics, and wanting to. And I think it further goes, Sarah, that you want to know that you're going to somebody that's a professional, and that it's not the guy with the gym bag that says, "Oh, I can take care of that." So wasn't that part of it too? Wasn't it fortuitous that you decided to Google this or Google that and find out what was going on with you?
Yeah, it was great.
Doc, I know you like it when you hear that, but most of the time a patient's going to get referred by their primary care doctor. Remember, but what about, maybe, I don't know if Sarah knows this, what about like when you have like what you think is a rash? So you go to the dermatologist. Yeah. You find out it's not a rash. Right. But you went to the dermatologist for 6 months.
Yeah. We get people from, in a lot of different ways. We get a fair number of people from other physicians, physician referral. But probably we get a little more from just, self-referral, just like what Sarah did. Yeah. They Google, and I'm glad, the internet is a wonderful thing. Sometimes it's not so good. But
especially when it must be true because I saw it on the internet.
Yeah.
But I still think, though, that that's a tool now that you use. Maybe, so I'm guessing that you also use the internet for other research. You do a lot of stuff there. Right?
Yeah. Yes, I do.
But that's new.
Yeah, it's new, and it's the reason I say that it's good is because, again, there's so many symptoms that people may not relate directly, intuitively, to vein issues. So, they might be, Googling cramping in my legs, right? Not knowing, what is going to pop up, and then they find, then they see repeated articles or whatever about the fact that cramping might be due to varicose veins and vein problems.
Yeah, so that's what I'd like, Sarah, for you to relate to when because you went and researched. When you decided to pull the trigger, did you ask Google, what is this? What?
Yes.
Yeah.
Yes.
Okay. And then did you also say, well, what are the treatment?
Yes.
Okay. And then what?
Well, then
in other words, I want to make sure. That's the point I'm trying to make. What I'm trying to make is a lot of people, use the internet, and it can be a problem because they can self-diagnose and do the wrong thing.
Right.
Take the wrong stuff, do the wrong thing. It didn't look like that happened here at all. Huh?
No, I think I'm hoping that Sarah felt like she got to the right place.
Yeah.
But
I definitely did.
Again, Sarah had a fair amount of understanding about what she was doing. You probably Googled, "Hey, where can I get my spider veins injected?"
Yes.
That's probably what you Googled.
Exactly.
And so, but again, there's a lot of people out there who are hopefully Googling other symptoms again that they don't know what to do with and where to go for.
That's another thing that I wanted to get at, because Sarah, you said that you keep, most of this stuff is all secret to yourself, but you must know others that went through a similar process and did it. So did you do this because somebody else had success, or did you just go, I'm keeping this to myself, I'm just going to go get this done?
I just kind of kept it to myself and went and got it done.
That's
but
really
I have told a lot of ladies about it.
Yeah.
Afterwards.
Sure.
And because they have mentioned different symptoms.
We talked to somebody a while ago, another patient a while back, and this is somebody that used to play tennis all the time and didn't play anymore.
Sure.
Because she was so conscious about the varicosities that she didn't want to be in a tennis short, and she didn't want to, she couldn't play tennis in long pants, so she stopped playing tennis.
Right.
What a terrible thing to have to stop doing something you really love because of that, right?
Yeah.
Oh, absolutely. Yeah.
And like I said, here in Hawaii, it's even more because we're less dressed. We can get along. It shortens the pattern of the day. So I think that maybe, Doc, you could sort of describe for Sarah and for everybody else is what you did once what procedure you did and how did, in your opinion, how did it come out?
Well, we did.
You did the ultrasound.
We did the ultrasound, and we found out that she had venous insufficiency. There was one vein in each leg that was a problem. Sarah got sort of the standard kind of procedure that we do for reflux or venous insufficiency, and that is that we did what's called venous closure. And the device that we use for that specific in that specific setting is a catheter that we thread into the vein.
It's a tiny little wire, right?
Tiny little wire catheter. And we everything we do through just little needle puncture sites. We don't make any incisions anymore, and everything that we do heals, pretty well. And so it's just a little needle puncture site, a little bit of numbing medication, and that catheter heats up the vein and closes the vein. So we're sort of cauterizing the vein from the inside. I think most people have heard that word before. We cauterize the vein, it closes down, and that stops that abnormal flow pattern of blood going down into the leg and pooling. When the vein fails, the blood goes in the wrong direction. It goes down, and that results in pooling of blood in the leg. And that's what creates the symptoms that we see, the heaviness, achiness, fatigue, swelling, etc.
Hey, but Sarah, it must be kind of cool to know that one is gone.
Yes.
Okay. That one's not coming back to harm me.
No.
But I figured out this, and I'm sure you have too, that means if you have a symptom, you get vigilant, you get it nipped in the bud before it can become a problem like it was, right?
Right.
I think that's the key.
And that's
everybody can learn that, we're ahead of the game.
Yeah, and that's why we do surveillance ultrasound, because hopefully we'll be catching things early as opposed to late, and it won't. We won't need, no matter what the problem is, we won't need to go through all those major things again. Typically, we can do something pretty minimal to keep the status quo.
Okay, so that means if you need to know something, you got to go to veinclinicsofhawaii.com and check it out for yourself. Sarah, you've been a joy to get to know a little bit. I think mainly because we need to show everybody that's listening is that this is not all life-threatening. You were just uncomfortable, and now you're comfortable. Isn't that alone must be worth the price of admission.
It's great. It's wonderful.
Yeah, so I think, Doc, that's a great way to encourage people that if you're even the least bit wondering about what's going on here, that there's the light at the end of the tunnel. Not everybody is going to be sharp enough as Sarah to go Google it and come in and say, okay, I'm ready to do this now.
Right.
I went and found out already. You're the guy. Come fix me.
Yeah. Well, yeah. We can evaluate and figure out what's going on with anything with respect to the leg. Now, it might be somebody else's field, and we'll send you elsewhere. But vein problems are a very, very common problem, and often they can be fixed pretty easily, and the patient goes home with a smile on their face, just like Sarah did.
Sarah's not having any problem smiling here. She's a smiley person. Sarah, thanks so much for doing this.
Thank you.
And Doc, we'll see you again next time.
Okay.
And you want to know more about what's happening, you got to go to veinclinicsofhawaii.com. That's veinclinicsofhawaii.com. See the depth and scope of what goes on there. You'll be fascinated. And thanks for being with us. We'll see you again next time.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.